More than 25 million men and women in the United States are affected by gallbladder disease, which occurs when the gallbladder, a pear-shaped organ located below the liver, becomes inflamed or infected, a condition called cholecystitis, or blocked, as a result of gallstones, the dominant condition affecting the gallbladder. Gallbladder problems. Who is most at risk? Gallbladder disease can affect anyone, but some people are more vulnerable than others. You are most at risk of having gallbladder problems, such as gallstones, if you are a woman, are over 60 years old, have a family history of gallbladder problems, are overweight or obese, have diabetes, take certain medications, are Native American or Mexican American. The more of these characteristics you have, the more likely you are to develop gallstones and other gallbladder problems. There are a number of factors that can increase a person's risk of developing gallbladder disease and gallstones. Some of these factors can be modified, such as your diet, while others cannot, such as your genes or ethnic background. Gallbladder problems. Risk factors. You cannot change gender. Women are twice as likely as men to develop gallstones. Pregnant women and those taking hormone replacement therapy are more at risk for gallstones, due to higher estrogen levels. Too much estrogen can increase cholesterol in the bile and lessen gallbladder movement, increasing the risk of gallstones. Genes. The tendency to develop gallstones and gallbladder disease often runs in families, suggesting that there may be a genetic link. A mutation in a gene that controls the movement of cholesterol from the liver to the bile duct may increase a person's risk of gallstones. Also, defects in certain proteins may increase the risk of gallbladder disease in some people. Age. People over the age of 60 are at increased risk for gallstones. This is because as you get older, your body tends to release more cholesterol into bile, which makes it more likely that stones will form in the gallbladder. Ethnicity. Native Americans and Mexican Americans are more likely to develop gallstones than other ethnic groups, probably as a result of dietary and genetic factors. Americans of European descent are also at higher risk. Gallbladder problems. Risk factors. You can change overweight and obesity. People who are even moderately overweight or obese are at increased risk of having gallbladder problems. When you are overweight, the liver produces too much cholesterol, overloading the bile and increasing the risk for gallstones. Fluctuations in weight. Rapid weight loss as a result of fasting or crash diets, and weight cycling, losing and then regaining weight, can increase cholesterol production in the liver, increasing a person's risk of gallstones. Diet plays a major role in gallbladder disease because diet influences your weight. People who are overweight and eat a high-fat, high-cholesterol, low-fiber diet are at increased risk of developing gallstones. In addition, too much heme iron found in meat and seafood, may increase gallstone formation in men. Medications. Certain cholesterol-lowering medications, such as gemfibrozil, Lopid, and fenofibrate, Tricor, can increase a person's risk of gallstones. While these drugs successfully decrease blood cholesterol, they increase the amount of cholesterol in the bile, increasing the chance for gallstones to develop. Other drugs that may increase the risk of gallstones include octreotide, sandostatin, and a group of diuretics known as thiazides. Octreotide is used to treat certain hormonal disorders and severe diarrhea caused by cancer tumors. If you are concerned that a medication you are taking may increase your risk of gallbladder disease, talk to your doctor. There may be another medication that will do the same thing without increasing your risk for gallbladder problems. Gallbladder problems. Other risk factors. Diabetes and metabolic syndrome. People with diabetes are at increased risk of developing gallstones and a type of gallbladder disease called the calculus cholecystitis, meaning gallbladder disease without gallstones. Also, people with metabolic syndrome, marked by obesity with abdominal fat, low HDL, good cholesterol, high triglyceride levels, high blood pressure, and high blood sugar, may be at increased risk for gallstones. Crohn's disease and other medical conditions. People with Crohn's disease, an inflammatory bowel disorder, are also at increased risk of gallbladder disease. In addition, cirrhosis of the liver and certain blood disorders, such as sickle cell anemia, also increase a person's risk of pigment gallstones that are made up of bilirubin instead of cholesterol. Surgery. People who undergo bariatric surgery to lose weight are at increased risk for gallstones. Organ transplant surgery may also increase the risk of gallstones, and it is not uncommon for some doctors to recommend that their patients have their gallbladder removed before undergoing an organ transplant. As you can see, many factors may increase your risk of developing gallbladder problems. While you can't do much about your genes or ethnicity, you can watch your weight and eat healthfully. Maintaining a healthy body weight is one of the most important things you can do to reduce your risk of serious health problems, including gallbladder disease.